Hello, my name is Stephanie Barnes, and this is my population level health education intervention presentation. My population health intervention project was completed in a neighborhood unprivileged city within the San Bernardino County, city of Rialto. The estimated total population is 99,000 people. Approximately 20% of the city population is below poverty level. The median housing income is approximately 45,000 a year. 68% are high school graduates, and only 10% are college bachelor degree graduates. 68% is Hispanic, 32% non-Hispanic. So the majority of the population is Hispanic. Here are the four top health-related issues. Rialto's highlighted four health-related issues were significant due to the inadequate source of nutritious foods and lack of physical activity found throughout the city. There were many fast food restaurants throughout the city, including several corporate chain grocery stores that catered to cheap eats and high-fat foods. The inadequate amount of parks, recreational physical activities, transportation services, um, and extra exercise fed into the development of these four highlighted health-related issues, which is hypertension, heart disease, diabetes, and obesity. Healthy People 2020 objectives for hypertension and heart disease. So it's to improve cardiovascular health through prevention, detection, and treatment of heart disease and hypertension. Early detection and treatment can decrease cause of heart attacks, stroke, and death. Hypertension and heart disease both have leading modification risk factors with chronic health conditions. Um, so hypertension and health disease, the risk factors would be smoking, cigarette smoking, unhealthy diets, physical activity, overweight, and obesity. Healthy People 2020 objectives for diabetes and obesity. Um, so reduction of diabetes mellitus complications, thus improving quality of life for people with diabetes or at risk for diabetes, and for obesity, promotion of health and reduction of chronic health conditions risk through nutrition, through nutritious eating, and maintenance of healthy body weight. Um, for diabetes, we want to reduce the annual number of new cases of diagnosed diabetes within the population, reduce diabetes death rate, reduce the rate of lower extremities amputation, because that's a real big complication from diabetes, and increase the proportion of adults with diabetes who perform self-blood glucose monitoring at least once daily. Um, for the nutrition, for the nutrition objectives, um, we want healthier food access, increase the number of states with nutrition standards for foods, beverages within school systems and to preschool age children, increase the proportion of school to prohibit the selling of sweet calorie-rich beverages and foods, um, and offer counseling and education related to nutrition and weight. So throughout the Rialto, the needs assessment, um, during my community and windshield survey, I interviewed many civilians and stakeholders within the community about their nutrition and comorbidities. I got the answer of they eat what's cheap and what is convenient. Excuse me. Mainly processed, canned, and fast foods. The city population did not understand what proper nutrition was. Comorbidities such as hypertension, diabetes, and heart disease was prevalent. Chronic diseases that are raised with diets, compromised and processed foods. Education is key to teach families and society to improve quality of life and promote healthy behaviors. To maintain good health, education regarding community diseases, and education of health diets and exercise can improve the community issues. So the goal is basically health promotion, educate the community, and decrease the chronic diseases. For the um, theoretical framework, the pre-seed 1 through 4 phases. So phase 1, the ultimate goal, health promotion through obesity awareness and nutritional intake. Phase 2, to identify the issue, poor nutritional intake and poor chronic health condition education. Excuse me. 3, reinforce factors to be addressed, culture aspect and lack of education. 4, language barrier, because the population is primarily Hispanic. So a lot of the labels and things don't come in Spanish, so that could be a barrier as well. The theoretical framework for the proceed phases 5 through 8. The implementation education plan was implemented through 2 educational health classes with focus on adolescent obesity and nutrition for the adolescent population. Phase 6, process evaluation. Proper planning and appropriate educational materials were provided. Impact evaluation. Health education classes compromise with healthy 2020 objectives in mind. Phase 8, the outcomes. Health education classes objectives were met through friendly quizzes and after the class. So the issues, one being a language barrier. Majority is a Hispanic population and Spanish speaking only. Not all nutritional labels, especially chip labels, is written in Spanish. Some of the population, the adolescent population, was resistant to change or modification. And educational qualities, they didn't know to read the back of the hot Cheetos and Taki labels. And they don't know what they really mean. Here is just a couple pictures of the class that I taught about the obesity and nutrition. The population level health education interventions. Here are just some of the interventions from the nutritional education. We wanted them to identify 5 healthy food groups, samples of each food group from My Healthy Plate, to find importance of food labels, and improvement modification of existing food recipes. For obesity, combo interventions would be to coordinate healthy eating and physical activities policies and practices through a school health council and school health coordinator. Help them identify a healthy BMI and maintain a healthy weight with better behavior patterns by choosing healthier foods groups, exercising regularly, and attaining good sleep. The ultimate goal for the population level health education project is to educate the population the importance of adequate nutrition and decrease the obesity uprising and decrease the chance of developing chronic conditions such as diabetes, hypertension, and heart disease. As these chronic health conditions can take a great toll on life. As for educational classes geared towards chronic health conditions, the leading objective is to incorporate education to diagnose and prevent further health conditions, complications to improve quality of life. So this project didn't cost very much. The classroom and space was provided by the high school. The PowerPoint was viewed through their projector. The materials was about $40 per class because of the flyers and handout copies, but it wasn't too much. So the evaluation outcome measurements, we structured quizzes and incorporated audience participation with the educational classes were implemented. Some of the short-term goals was 80% of the class participated in questions and answering quizzes about my plate plan, tips for nutrition and modification for Hispanic foods, as well as other snacks they can have besides hot Cheetos and Takis. Maintain a healthy weight with better behavioral patterns by choosing healthier food groups, exercising regularly and attaining good sleep. Long-term goals will be formulation of extra testing of educational materials with the 3-month timeline, such as once a month and again at the 3-month. Project evaluation, results, and conclusion. Both classes gained a great deal of knowledge of the health facts that's in hot Cheetos and Takis and the effects on one's health. So a couple weaknesses was language barriers, knowledge deficits, and for the adolescent population, some of them just didn't care about the effects of Takis and hot Cheetos on their health. The strength was some of them did care, and they did acknowledge that they need to eat healthier foods. Here are my references. Thank you. Hope you enjoyed it.